Welcome to Nursing Mantra. I hope all you are keeping well. Now, we already discussed before regarding the respiratory system. I hope all you are watching the respiratory system and taken the notes. If you have any doubts, you can just comment in the comment box, and if you need any further information regarding the respiratory system, you can just comment there. Already all the videos were uploaded in the respiratory system, and you can see the most of the videos in the Facebooks. And if you have any doubts, you can check my website, NURSINGMANTHRA website also. Informations will be there. And I hope all you subscribed our channel. So for getting the updated videos, you have to subscribe, and I will be adding more contents from the MOH, DHA, HAAD and other PROMETRIC, Gulf countries PROMETRIC exams. I will add more contents there, so it will be easy for you for your quick study. So please subscribe the channel to get the updated videos, and write the notes as it is and make the notes for you. Okay, today I am coming with the ophthalmology system. I think ophthalmology, it is very less content we have regarding the ophthalmology, and some important disease conditions are there, and some of the diagnostic tests. I hope it will finish within one day the class. So today we will first move through the anatomy of the eye. So for the anatomy, basically we should know how many layers for the eye. So we have mainly 3 layers for the eye. So first, external layer, middle layer and internal layer. So external layer, we have the anterior and posterior side, it is there. If it comes in the anterior side, we are saying it's cornea, and in the posterior side it is sclera. Especially in the middle layer, we have choroid, iris and ciliary body. You can see in the image shown here. And internal layer, we are calling it as retina. These are the main 3 layers of the eye. That is external layer, middle layer and internal layer. So these are the structures and rods, cones, okay, all those things you can see, but the question wise it is not that much important. So the important topic is the diagnostic findings. First diagnostic finding is Snellen's chart. I hope all you practiced with the Snellen chart when you are studying in your nursing program, or when you are working there, you all familiarized with the Snellen chart. So what is Snellen chart? You are checking the visual acuity. So how you are doing this Snellen chart means, so it is help to identify the visual acuity, and you have to close one eye and you have to read carefully with the left eye. If you are closing right eye, you have to read with left eye. If you are closing the left eye, you have to read with the right eye. It is like that, and there will be a Snellen chart. You have to read, you know already that one, E3, 1, 2, 3 numbers and all there. They are making it that one, and the distance will be 20 feet distance will be there. Within that 20 feet distance, we are reading the chart. The normal vision is like 20 by 20, the normal vision, and the patient reads at 20 feet distance as I discussed before. So 20 by 200, this is the question they are asking there, like they can give any numbers. That means what it is. 20 by 200 means we are calling the person as legally blind. So normal person can read at 200 feet. Okay. So if the normal person can read at 200 feet and the blind person can read only 20 feet distance, that one. So 20 by 200 is we are calling them as legally blind people, and 20 by 40, that means patient only read at 20 feet, the normal person is reading at 40 feet. If 20 by 60 means normal person will read at 20 feet and the patient will normal person will read at 60 feet, the patient will read at 20 feet. Okay, so like that they can ask the question like that, 20 by 40, 20 by 60, 20 by 200, like that, what it describes. That is only the important thing regarding the Snellen chart. Usually they are asking the measurement here. The next diagnostic procedure is fluorescent angiography. So it is used to visualize the blood vessels in the eye. So they are using the dye ointment, dye injection they are applying. So mainly do after any injury to the eye. So this fluorescent angiography, by using the contrast material after an injury, eye injury, they are using it. So pre-procedurally we have to take the consent and we have to make the patient NPO, ask the patient to keep NPO and check for allergy to shellfish. So iodine allergy we are checking, allergy to shellfish we are checking, okay, and we are doing the procedure. And what is the post-procedure care for fluorescent angiography? The post-procedure care, we have to keep the ice pack to prevent the bleeding, and IV fluids to help. The more IV fluids we have to give to the patient to excrete the dye. And the dressing, we should keep the dressing for 6 to 8 hours. We have to keep the dressing and never try to flex the extremities. What will happen? There is a intraocular pressure changes will be there. So never you flex the extremities. That is an important thing in fluorescent angiography. Then the site, if the fluorescent angiography site, if you are seeing like if it is yellow color or the patient will be getting warm flush sensation, inform the patient it is normal after the procedure. Usually in the exam time, exam questions, they will be asking like this: after the fluorescent angiography, the patient experiences yellow color at the site and some hot warm flushes in the eyes, and patient is complaining to you. What is your immediate management? Maybe the administer medications, administer eye drops, okay. So it is a normal procedure. You can tell to the patient it's a normal thing happening after the procedure. So after some time it will be okay. Maybe that is the option you have to select. So because after the procedure, the yellow color and warm flush sensation is normal after the procedure. And urine color also will be greenish, like for 24 hours it will be like greenish color, greenish urine. If patient have abnormal itching in the eye, it indicate the reaction to the dye. If there is any itching in the eye, we have to inform to the doctor. So inform to the doctor will be the option we have to take if the patient complains of abnormal itching. And the management for the itching, reaction to the contrast and all, we are giving Benadryl and diphenylhydranil. These are the medications we are giving for this itching or abnormal itching in the eyes, followed by the fluorescent angiography. I hope you understood up to here regarding the Snellen chart and fluorescent angiography. Next, our next diagnostic procedure is corneal staining. What is corneal staining? That is used to detect any minor injuries or any foreign bodies in the anterior chamber of the eye. So here we are applying the fluorescent dye ointment and ask the patient to blink eyes. So once they are blinking the eyes, we are keeping the blue litmus paper. So that we are keeping the blue litmus paper, and if the blue litmus paper comes to green color, it indicates the short non-intact epithelium. Okay, and this is regarding the corneal staining. Not that much question related to the corneal staining. And next, our diagnostic finding is related to the ophthalmoscopy. I hope all you know regarding ophthalmoscope. You all are seeing in the hospitals, doctors are seeing, okay, visualizing the fundus by using the ophthalmoscope, and maybe you all practice with that also. So we are visualizing the anterior chamber of the eye, fundus of the eye, we are visualizing with the ophthalmoscopy. So what is the main nursing responsibilities? That is also, they can ask the questions like the main important thing is like dark room. We have to provide the dark room when you are examining the fundus of the patient, and this is dark room will stimulate the pupil dilation, and furthermore we are providing the mydriatrics to dilate the pupil. So how we have to hold the ophthalmoscope? So if I want to see in the left eye of the patient, I have to hold the ophthalmoscope in the left hand, and if I want to see the right eye of the patient, I want to hold the right hand. Ophthalmoscope I want to keep in the right hand. So same manner we have to keep the ophthalmoscope. Okay, that is an important question, how to hold the ophthalmoscope. And what is the result of this? Anyway, we are checking this one, and how we can identify any problem is there or not. So absence of red glare indicate cataract. Normally we can see one red glare. So if there is any absence, we are saying it is cataract. Okay, and they can feel some of the any injuries or anything, foreign bodies, anything they can identify in the ophthalmoscopy. Okay, up to here I hope you all clear. So now the continuation of our diagnostic test, we have next diagnostic test is confrontational test. So confrontational test, it means to detect the peripheral vision. So the nursing responsibility, the examiner and the patient are sitting at the opposite, face to face, they are sitting and closing the eye, and the one moving object, they will move object or the hand and check the examiner and the patient seeing the object at the same time, means it is a normal vision. And next our diagnostic measures is tonometry. So you know tonometer, to measure the intraocular pressure. So what is the intraocular pressure? Normal range, it is 10 to 21. The normal range between 10 to 21 mm of Hg. But in the morning time, slightly it will be elevated, but it is okay. Okay, regarding tonometry, the normal range, you have to be study regarding the normal range of intraocular pressure. And the seventh one is HAAD test. HAAD test means it is used to detect the color blindness. So it is used for the color vision, and there will be several dots of different colors. We have to identify the color. Patient has to identify the color. And the blue blindness patient, for them it will not be useful, because dots are usually blue in color and it is sensitive to red and green color. So these are the main diagnostic tests in the ophthalmology system. So next we can see what are the important cranial nerves which is related to the ophthalmic system. It is optic nerve. So optic nerve, it will help for the sight. And the third cranial nerve, that is oculomotor, that is helping for the eye movement. And we have the fourth, that is trochlear nerve, that also helping for the eye movement, and the sixth one, abducens, also helping for the eye movement. So any problem to these cranial nerves, it will cause the problems to the eye. So these are the main diagnostic tests which we are conducting in the ophthalmology system. I hope all you understood regarding the diagnostic test. So now we will move through the what are the disease conditions, important disease conditions. So first important disease condition is main thing, refractory errors of the eye. So we will move through that. So now we will discuss regarding the refractory errors of the eye. So what are the refractory errors? Do you know what is the name we are calling for this one, normal vision? It is ametropia. So ametropia means it is normal eye. And what is, you have heard regarding the short sight, long sight, and we are putting the lens for that, separate lenses. So what is long sight, what is short sight, what is the measures we have to take, and that is an important topic which is they are asking in the exam view of the myopia. Myopia means it is short sight. Myopia, short sight, and which we are correcting with the concave lens. And hyperopia means it is long sight and we are correcting it with the convex lens. What is presbyopia? Presbyopia means it is due to the aging process in the old age and all, we can see the loss of vision will be there because of the decline of the muscles and nerves, and we are correcting it with the convex lens. And other thing is astigmatism. It is due to the irregular shape of the lens, and we are correcting it with the use of cylindrical lens. Only this much related to refractory errors you want to know. The as a crash course, you can just learn the which lens you want to use for each condition. That is only enough. That much is enough. And okay, metropia, myopia, hyperopia, presbyopia, and related to astigmatism also. Now, next, what is the another important topic is glaucoma. So now next we will move through the glaucoma. So what is glaucoma? It is due to the increased intraocular pressure. So glaucoma we have acute and chronic. In acute we have open angle glaucoma and closed angle glaucoma. Same like chronic also we have acute angle glaucoma, that means open angle glaucoma and closed angle glaucoma. Two types are there, acute and chronic glaucoma. So which is most important glaucoma is acute angle closure glaucoma is most important glaucoma. That is a medical emergency. Patient will get the sudden eye pain and possible nausea and vomiting. So they can ask the question like which is the most important medical emergency type, okay, glaucoma type. That is acute angle closure glaucoma. So it is due to the increased IOP. So retinal damage will be happening here. So what are the signs and symptoms you can see in glaucoma? That is, we can see tunnel vision. What is tunnel vision? Loss of peripheral vision. The sideways vision will be lost, and the patient can see only in the central part only. That is when we are going to through a tunnel, same like that. So tunnel vision, and there will be halo vision. We have seen in the digoxin toxicity, we can see halo vision will be there as a side effect of the digoxin. Same like that here in glaucoma also halo vision will be there, and headache, nausea, vomiting or flushness, everything will be there. So in this glaucoma, if we are correcting also, patient cannot go to the previous state. Only we can preserve the current vision. Okay, we can maintain the present vision only. So what are the diagnostic measures we are doing for this glaucoma? That is tonometry and gonioscopy. Tonometry and gonioscopy. The management which we are doing the surgery is trabeculoplasty and iridectomy. So this is the management for glaucoma. And one of the important question for this all MOH, DHA and other PROMETRICs, it's like which drug is contraindicated in glaucoma? That is atropine. Atropine is contraindicated in glaucoma. So for what are the, before the surgery, what are the pre-op measures we have to take? Patient has to give the consent, and we have to keep the patient on NPO. We have to administer miotics, beta blockers to the patient. Miotics example pilocarpine HCl, and the side effect of this medicine is GI upset, nausea, vomiting, diarrhea, dizziness, and the sweating, running nose, flushness, chills, fever. All these symptoms will be there for this pilocarpine. And in glaucoma we have to avoid anticholinergics as we saw the atropines, and to prevent the increased intraocular pressure. And cyclopgs we are giving for muscle relaxant, we are providing here. Then carbonic anhydrase inhibitors, example acetazolamide. You have heard regarding the Diamox tablet. So Diamox, okay, that will decrease the production of the aqueous humor. So this is related to the glaucoma, and the nursing management, which is the important thing, is the pain. So pain related to acute glaucoma, then there will be fear and anxiety related to the procedure, and impaired sensory perception will be there. And one of the important thing is that we have to inform the patient that the medications which they are using for this glaucoma, that is lifelong. They have to take the medication lifelong. So this is the related to the glaucoma, that is It is due to the increased intraocular pressure and due to the retinal damage is happening here, tunnel vision, halo vision, okay, all the symptoms will be there. Then headache, nausea, vomiting, everything will be there. And we are doing the diagnosis as tonometry and gonioscopy, the management trabeculoplasty and iridectomy. Pre-op, okay, all the what are the things, the pre-op procedure and the nursing management also you have seen. I hope you understood regarding the glaucoma. This is a short note related to the crash notes related to the PROMETRIC exams. So just this much is enough related to the glaucoma, and next we will move through the cataract. That is one of the important topic in the ophthalmology, that is cataract. Next, our important topic is cataract. What is cataract? Cataract is due to the opacity of the crystalline lens. So we have mainly 4 types of cataract. So first one is senile cataract. Senile cataract, it is due to the aging process. And second one is traumatic cataract. Trauma, it is related to the trauma. And third one is congenital cataract. By birth itself, congenitally the baby is getting this cataract. And fourth one is secondary cataract. It is due to the some of the disease condition. It is due to secondary disease conditions. These are the main 4 types of cataract. And we can see what are the clinical features for this cataract. We all know that blurred vision is the main important clinical feature for this cataract. And it is the first feature. What is the first feature for cataract? That is blurred vision. Then diplopia or double vision, and then photophobia will be there, sensitivity towards the light, and absence of red glare on ophthalmoscopy. Previously we told in the glaucoma section, that is fundoscopy, we have told that absence of red glare on ophthalmoscopy, that means it is cataract. And patient will be having dim light vision. So these are the clinical features of cataract. There will be blurred vision is the first feature, diplopia will be there, photophobia will be there, absence of red glare on ophthalmoscopy, and patient will be having dim light vision. What are the management? Here we are doing the procedure is IOCA, that means intraocular lens extraction or intraocular cataract extraction, okay. And EOCE means extraocular lens extraction, okay. And keratoplasty, lens repair. These are the main management for the cataract, that means surgical management. And what is the pre-procedure care we have to do? Means we have to take the consent from the patient, same like other procedure, and we have to keep the patient on NPO. Then we have to administer mydriatrics, that is atropine. Example is atropine. That is important thing is that is contraindicated in glaucoma. So we have to administer here, it is mydriatrics we have to administer. Example for mydriatrics is atropine. And post procedure, main important question they can ask, what is the position you are giving after cataract surgery? So we are providing the position is semi-fovulous with non-opposite side and eye patch. We have to ask the patient to keep the eye patch and the black glass in the, especially in the night, they have to keep the eye patch, and they have to wear the black glasses during the daylight time, avoid eye straining during the daylight. And they have to avoid the itching, okay. Ask the patient to avoid itching on the eyes. If they are getting itching sensation also, they should not itch or rub that area. It will cause further trauma to that particular area. So they have to keep eye shield to prevent the itching, especially during the night time. And almost it will take 3 to 4 weeks to get normal vision. So they have to avoid bending below knees. Okay, they should not bend below knees, and they should avoid reading, avoid watching the TV, then constipation, sneezing, coughing, and blowing of the nose. Okay, these things they should avoid least. Then if pain or secretion is there, they have to inform to the doctor and ask them to follow the drops, eye drops properly. They have to keep based on the timings, they have to pour the eye drops. Okay, these are the post procedure care for the cataract. Next we can move through the nursing management. Important nursing management is impaired sensory perception and risk for injury. These are the main important nursing management. So the cataract we have, that means it is due to the opacity of the crystalline lens. We have mainly 4 types of cataract, that is senile cataract, congenital cataract, secondary cataract, and traumatic cataract. The first important main feature is blurred vision. Okay, then there will be pain, will be the diplopia, photophobia, and patient will be having dim light vision will be there. Management is IOCE or like EOCE, IOL, intraocular lens implantation. Okay, keratoplasty. Keratoplasty means the lens repair they are doing. Okay, so these are the pre-procedure and post-procedure care and nursing management. I hope you understood regarding the cataract. I hope all you understood up to here, you are clear. So now we will move through the another topic, that is retinal detachment. So what is retinal detachment? As a part of exam view, it is important question like retinal detachment section, they are asking more questions. So we will move through the retinal detachment. So what is retinal detachment? So the detaching the retina because it is due to the tumor or sometimes it is due to the trauma. So retina is detaching from the position. So what is the clinical features for this? The clinical features will be sense of curtain being drawn. Some curtain is falling in front of you. Same like that feeling will be there. This question usually they are asking. So sense of curtain being drawn, which is seen in which disease condition. So it is retinal detachment. And flashes of light will be there, like a floating of light will be there, black spot will be there, or bloatiness of the retina. These all are the clinical features which you can see in retinal detachment. So what is the diagnosis? How we can identify the retinal detachment? It is by fluorescent angiography. Already we have discussed regarding the fluorescent angiography first, and the fluorescent angiography, it will leads to the diagnosis of retinal detachment. And the management means that we have to closure of the both eyes. If the retinal detachment is in the left eye, the right eye also has to close. So both eyes we have to close to prevent the eye straining. That is the management, immediate management which we have to do. And the surgical correction is by vitrectomy and cryosurgery. Okay. Then diathermy and laser therapy. So vitrectomy, cryosurgery, diathermy and laser therapy is the surgical management for the retinal detachment. And we have to avoid below knee bending. Okay, the patient has to avoid bending below knees. And the position for all eye surgery. So usually they are asking the question like some of the position for cataract surgery, position for glaucoma surgery, or all the eye surgery, the position we are using is semi-fowler's position with unoperative side to reduce edema and swelling, etc. So we have to keep the patient in the unoperative side. We have to provide semi-fowler's position. Okay, this is the position which we are providing for the all eye surgeries. And post, if we are doing vitrectomy, so post vitrectomy, the position we have to provide is prone position. That is also important question which they are asking during the exams. So post vitrectomy, especially we are giving prone position. Other all surgery we are giving the semi-fowler's position. So after the detachment of the retina, we should apply the pressure minimum of 2 weeks to prevent further detachments. So we have to avoid some pressure in that particular area where the retina is detached to prevent further this one detachment of the retina. That is important. At least for 2 weeks we have to provide. And if like post-operatively, if the patient complains like sudden sharp pain, we have to inform the doctor. So in the case of retinal detachment, if the patient complains of sudden sharp pain, what is your role as a nurse? You have to inform the doctor and ask the patient to avoid sudden head movement. Okay, avoid the sudden head movement, that is also important. Then reading, the patient has to limit the reading for 3 to 5 weeks. Then avoid squinting, straining, constipation, or lifting of heavy objects. Then avoid bending. All these things the patient should avoid postoperatively. This is related to the retinal detachment. So I hope all you understood regarding the retinal detachment section, and today we will bind up our topics related to the ophthalmology. So next video we will be seeing the other topics related to the ophthalmology, and I hope all you understood this all classes. If you have any doubt, you can just comment in the comment box. So next day we will go through some of the topics. We will check what are the topics which we will go through the ophthalmology next video. So we can see what are the next updated videos you will get regarding the ophthalmology system. So these are the continuation of the topics related to the ophthalmology, that is hyphoma, foreign bodies in the eye, macular degeneration, and what is the eye medication administration, and regarding eye donation, care of legally blind people, enucleation, conjunctivitis, stry and squint, extraocular muscle function test, ocular melanoma and condition. These are the topics which we are going to take in the next class. So keep on watching the videos and please subscribe our channel Nursing Manthra to get the updated videos. Thank you.